Okay. So, hello, for those that don't know me. It's an echo going on here, so I keep looking around to see what's going on. But I am Dr. Amanda, and I would like to wish y'all a happy new year. We are in the next year. So, yes, I'm so happy to be here with you on today. So, if those again, I am a part of Atkins Enlightenment Lifestyle Medicine, and it is just a pleasure to talk with y'all today. So don't forget to, talk in the chat. Let me know who's there, who's watching live. If you're watching the replay, I'm grateful you took the time for you because choosing to learn about your health is already a step forward towards healing. But always, put your comments or questions in the chat, and I'll be looking down for those to see if I can answer those along the way. Okay. So today I wanted to talk about something very important to you because I get this question or this info, things about this a lot. So um, it's something that in healthcare we rarely explain, and to know the difference that's going on, the difference between managing disease and restoring health. And this conversation is especially for you if you have pre-diabetes, diabetes, have high blood pressure, you're on medications, wondering, is this really helping? And is this really the best that it gets? Just being on all these medications, or if chronic disease runs in your family and you want a difference for your future. And I can tell you that I was a part of, two of these categories. And then people in my family are part of all these categories. And then, of course, patients. And people are just wanting to know something different. So I just thought I would come on live to actually explain the difference here. Because there's so much out there in the healthcare space that people are like, doctors just want to make sure you stay sick because otherwise they won't get paid. They won't have, a health system or anything like that. And I know it can be very frustrating. So I want you to, though, to hear this clearly from the beginning that even if you've been diagnosed with an illness, that diagnosis is not your destiny. And you deserve care that focuses on healing and not just prescriptions. And I have been now practicing medicine for over 15 years. And even from the year one, I've had people ask, so many times, what else can I do besides medication? And I can tell you that we were not trained that way. We were not set up. The healthcare system is actually, unfortunately, set up in a different way. So in traditional medicine, the system is built around like short visits, trying to get you in and out. Lab numbers, what did your lab show? Not even asking how you feel. And I'm just going to change this based on your numbers, prescribing more and more medications, and then giving you medications to help with the side effects of the medications that we gave you, and just managing symptoms and not necessarily helping you to heal overall. So if you have like high blood pressure, you get a pill. If your hemoglobin A1C rises, which is a 3 month blood sugar average for people that have a diagnosis of diabetes, you get another medication added. If your numbers in your labs get worse, then we just increase the dose and add in more medication, right? That's what we've been doing here in traditional medicine. And that's how most healthcare traditional medicine is designed around disease management and not disease reversal. Okay. And it's not because we as doctors don't care. Again, it's not because we don't think that your health is important. It's not that we are trying to, um, let's say, get rich off of your being ill, because I've had a lot of people say that, like, oh, you're putting all these diagnoses in because you just want to get paid more. And that's not the case. Like, again, traditional medicine, the way that the insurance is set up, that can actually be the case for some. But as doctors, most of us went into medicine to actually help patients and not to make them sicker. Okay. And again, it's because the system does not allow for time, depth, or personalization. And we just don't have the time for that. Like, it's just like they just want you to keep, you know, like a factory almost, like going in and out of rooms and saying, hurry up, you got to do this. But make sure you keep high quality medicine, but you only get 5 minutes with the patient and all these different things. And I wanted to come on here specifically today to talk about this because today is the 1 year anniversary of me stepping out of corporate medicine into my own private healthcare and private practice virtual medicine space. And I'll talk about more about that later. But it's just that it was like so important to me because so many patients, I would see them and they would just, get sicker. And there was very little time and space to ask, why is this happening? What's driving all the inflammation? What role does food, stress, sleep, trauma, or lifestyle is playing in this illness or in this person's diagnosis? And most importantly, how do we help the body heal? There was very little space for that. And as a physician, I would see, patients in that, 15 minutes that I was allowed and see that I was just trying to ask them, very high level questions and see that they were, doing everything right. They were, trying to take their medications as faithfully as they could. And, coming in for their visits when they could get off work, things of that nature, but was really trying to be involved in their healthcare, come in and try to ask questions. But I'm like, okay, we can talk about that next time because we only have 15 minutes and they're going to, keep us going and say, you got to keep going and going and going. And it was just that patients were getting sicker and sicker and it just didn't sit right with me. And that's why, initially I was like, I don't know what else to do. We were not trained this way. And we looked out and in my personal health. And then, a few patients again starting to ask, what else can I do besides medication? I looked into other aspects of medicine that wasn't the traditional route, things that are now more widely talked about, but not to the extent that it should. And it is really talking about lifestyle medicine. And where that's comes in is because it comes down to coming up with the root cause of the chronic disease and not just managing symptoms. So we're not just managing illness, we're trying to actually help the body heal from the inside out. Okay. So when I actually stumbled upon lifestyle medicine, I was like, it's very crazy how that happened because my own personal health journey, some of you have heard, but I was an obese teenager. I had to do what they call the presidential physical fitness test growing up in the 90s. And I weighed 199 pounds as like a 13, 14-year-old. And I was like, there has to be something else I can do for my health. And at the time, I wasn't really going to the doctor, but looking back at the like pictures, I could tell that I had a lot of insulin resistance because I could actually see those signs for people now. But at the time, I didn't know that and feeling very tired and, grumpy, overweight, wanting to not really move around because I didn't have the energy. And I was just looking for things to do for myself. And so, as you know, for some people, I started exercising because I was more like a bookworm, which I still love reading books, but I was out more, doing exercising. And then I became a vegetarian at the age of 16. And you're like, how in the world? Indiana in the 90s, that was not something that people did. Nowadays people are like, oh yeah, that would be easy to do. But that was not something easy to do, especially because at the time my father was a meat delivery truck driver. So we always had like hot dogs, bologna, bacon, sausage, all those processed meats that we now know are not good for us. But that was what we were, or eating at the time. And I just decided I was not going to do that. And it just comes down to, what I was looking at for my own health. And then because I had that experience and then that people were asking me what else can I do besides medication, I was like, well, there has to be something out there in the medical world that would talk something similar to this. And I was just Googling stuff at one time and actually found out that there was something called lifestyle medicine. And I was like, oh my gosh, like this is something that I've been looking for myself and what patients have been actually asking for. Excuse me. And I actually educated myself and, actually got into the lifestyle medicine and became certified with that to learn more of how to do it in an evidence-based way. And again, it was something that patients were asking for, like what else can I do besides medication? And then also for myself and other patients that I have helped in these past now 15 years, almost 16 now. Oh my goodness, 16 years. Well, we actually, again, with lifestyle medicine, as like I said, going around the long story, that it was actually very interesting how I came upon it. Like I said, just Googling things of how to actually learn about evidence-based medicine that would help actual patients and myself to actually be able to do something to not just manage illness, but to actually heal from the inside. Okay. So, why do we talk about lifestyle medicine? Again, we want to get to the root cause of the illness and not just managing symptoms. And we look at 6 different aspects. And, when you hear these things, you're like, well, that makes sense. Like, who wouldn't have thought to do this before and actually implement these changes into their life? Okay. So, we always talk about nutrition. And I always tell people that 7 of the 10 causes of death in the US are linked to nutrition. So just think about that. We talk about physical activity. We talk about restorative sleep. We talk about stressing less and stress management. We talk about having great social connections and also avoiding harmful substances like excessive tobacco use or any tobacco use and excessive alcohol use and other drugs of that nature. So we look at all those things. So for someone with prediabetes, diabetes, or high blood pressure, this matters because the conditions are largely driven by insulin resistance, inflammation, and lifestyle patterns, not medication deficiencies. Okay, so you're not deficient in medication. It's something that we need to change as far as the lifestyle. So what we do, we look to improve your food quality. That's why we talk about nutrition, especially with fiber intake, because most time we think that when we change our diet, we're going to be low in protein, but actually we're low in fiber. If you look at the standard American diet, which is unfortunately called the SAD diet, standard American diet, because we really lack a lot of nutrients, and fiber is a big one. We also want to focus on blood sugar regulation, stress hormones, and sleep rhythms. Okay. We don't just want to lower numbers with the labs. We actually want to see restored metabolic health. Okay. So, this is why many patients, when we actually work with lifestyle medicine, we see a lower hemoglobin A1C. Again, that's that 3-month blood sugar average that people that have a diagnosis of diabetes or even pre-diabetes have. And even with the diagnosis of prediabetes, which would bring your hemoglobin A1C to like 5.7 to 6.4, that does not mean like, whew, at least I don't have diabetes. No, that is a warning sign for your body to say, stop, 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 please turn around, go the other way. Don't keep going this way. Okay. So we want to see the lower hemoglobin A1C. We want to see your blood pressure numbers better. We want to see fewer medications and sometimes zero medications. For a lot of patients, that is actually possible. More energy, which was huge for me. And a lot of my patients are like, I didn't realize how bad I felt until I started doing this program and actually working with you with lifestyle medicine and just have more energy to actually do things better, to actually have clearer thinking. Like they always like fogginess in the brain. They was like they didn't have that clear vision of what they were to do that day. They're like they were just kind of like Groundhog's Day. Just every day was the same. They just couldn't think outside of that. And again, until that fog was lifted, they're like, oh, I couldn't really figure out what was going on. And again, this can definitely be due to a lot of inflammation that's going on in the body. Okay. So other aspects that you can actually benefits that you can see is actually better sleep. So a lot of times you're like, oh gosh, I'm tossing and turning. I wake up tired. I don't know what's going on. I wake up several times in the night. But actually, when you change these things, you actually get better sleep and a confidence that our bodies are actually, and confidence in our bodies again, like just the way that we look, the way that we feel, and we just feel overall better. And this is healing, this is prevention, and this is possible even if you've been told otherwise. Okay. So don't feel like you are too far gone that you cannot actually heal and go to the next step. Okay. So also want to talk about something that's very uncomfortable, but necessary. Okay. Because a lot of times when I talk about this, people like they go into defensive immediately. Okay. What are we looking at? And we're talking about actually investing in your health. And we are very systematic with some things. Some things of a system is good, some things are not so good. So here we're trained to like our health insurance should cover everything and we should not have to pay for anything. But when we look at it, like that's not usually the way that we run our lives. We don't run our lives any other way, but we think that healthcare should be covered by insurance, and I'll leave that. And if it doesn't, if the insurance doesn't cover it, then that means you don't need it, or it's not possible, or whatever it may be. Okay. But let me just, break it down for you. What do we actually invest in? Um, the iPhone, the phone, or if you're an Android person, like phones used to be like when they first came out, cell phones, it was like it was included in the plan, you just got it with it. And now these phones are thousands of dollars, and it's not even where you can hardly even trade in. Like you have to get a phone every few months to actually keep up, and these like phones are thousands of dollars, and I was just floored that's something like people are like in line for this, like uh, sleeping and camping out to like be the first ones in line to get this. But then when you talk about, investing in your health and actually paying for actually health care, like wellness, it's like, well, no, I'll just cover whatever's covered by my insurance. That's all I want. Okay. We invest in cars. I mean, the prices of cars are going up, up, and up, and the value of the car goes down, down, and down. The engine will only work for so long. If you can find a car that is working after 100 years, yeah, I need to know what did they do? Like if they invested nothing into that car, right? It's not going to do that. So just think about your own human body. Like this body has to last you from birth until you pass away into the next life, right? So when you think about that, like you really need to take care. You need to invest in this body. You don't get a full body transplant, which one of my patients was, jokingly asking, can I just get a full body transplant? It's like, unfortunately, they don't have that. But even for when you do get, different transplants for people that need them, whether it's your heart, your lungs, your kidneys, liver, whatever it may be, that you then have to take medicines because that's not your own human body. That was not how your body was actually made. And it does not necessarily work the same as your original body parts would have. Again, the way that medicine has actually evolved is incredible, and I don't want to take that away from the advances that we have made in the medical world. But we just have to remember that the human body, as it was created, is so miraculous. And it actually, I remember taking embryology in med school, and I'm just like, of all the things that have to go right for someone to actually come into this world and not have any deficits or any type of issues. I mean, it is amazing of how many things have to fold the right way, go this way and not that way. It has to stop at a certain time and it has to start at a certain time. It's just amazing. So when we think about that, like nothing can replace that initial like human formation. So we want to think about that when we're investing. What else do we invest in? Me for myself, I invest in education, which I think is very important. I would not be a doctor if I did not invest in education. But when I think about the hundreds of thousands of dollars I put into that, that how much more my own health and wellness and my body is, and how much we need to put into that. So we would think about that as we are telling, our kids that we should make sure we get good grades and we go to college and we invest in knowledge. Like all that is important, but not at the sacrifice of our own health and wellness. Okay. So we just want to think about those things. Okay. Um, it is okay. So what else do we invest in that are high dollar that everyone thinks they should have? Homes, of course, homes. So again, the prices of houses are going up. And now they're even talking about having a like mortgages for 50 years. Could you imagine now are having to pay like that, mortgage for 50 years? Like that's basically your whole life, working life. Um, I mean, even beyond that, because most people retire usually after 30 years of work, but you would still have to be working to pay off the mortgage. So just think about the things that we invest in. Because when it comes to our bodies, we're taught to wait until something breaks. And so then we go to the doctor and expect them to fix everything that actually has gone wrong. So Here's the truth that the most expensive healthcare you can have is delayed care. So you're waiting to actually cure something instead of prevent something. Okay. So the most costly treatment is preventative disease progression. Okay. So what we can actually do is actually prevent disease from like going from pre-diabetes to become diabetes. Like I said, pre-diabetes is a warning sign. High blood pressure doesn't have to mean lifelong medication escalation. So you're like, some people are like, I don't want to start a medication because I'm going to then have to go on more and more and more medications because my body will be used to it. So these are things you want to think about when we're like, well, I'll just wait until something happens, or I'll just, put my head in the sand and just think that I don't have to worry about it. And we don't want to do that. Okay. So when you invest in your health early, before complications, you're investing in your future energy, your ability to travel. So investing in those vacations are not bad, but your ability to travel, your mental clarity, like we talked about, decreasing that fogginess that occurs, our independence, especially as we get older. We want to be able to do things for ourselves. So we want to keep up, keep our body healthy, keep our muscles moving, all those things. We want to be able to invest in our family. So many of us, especially in my age, or have like children, are helping our adult parents, our elderly parents, senior parents, our future generations. We want to be able to invest in them. And then we want to invest in your calling. So there's so many things that you can choose to invest in. Like when you invest in your body, that you are actually investing in more than just your health, your physical health. Okay. So your body is the only place you have to live. That means this is the most important investment that you'll ever make. Okay. So we talked about this a little bit already, but I just want to dive deeper into why people ask, or why they ask me, why do I not take insurance? And we talked about this a little bit already, but the honest answer is that insurance companies are the middleman. They don't work for you. They don't work for you. So we don't want to just think about, okay, what insurance covers, and that's all I want to get, because that is sometimes not the best option, and sometimes not looking at the whole picture. So when insurance is involved, it dictates how long is your visit can be, because we want to be able to dive deeper, but they're like, no, you need to see so many patients in a day to get through all these, and there's only so many hours in a day. We still have to, as medical professionals, physicians, we still have to eat and we still have to sleep. We have other things to do outside of the office. So just think about that 24 hours in a day, like what you can get done. They also dictate the insurance, when the insurance is involved, what labs we can order for you, because I have a lot of people that come in like, I want everything done. Like everything. There's so many different labs out there, and different labs can tell us different information, but we have to have a specific diagnosis when we order through insurance. And if you don't have this diagnosis, then your insurance will not cover it. Then you're mad because you're like, I only want what insurance covers, but I still want this test. And it goes, all around. It dictates what a treatment is allowed. So I might think that, your best treatment is to actually work closely with a dietitian, work with a sleep specialist, because that's really going to actually change your underlying health. But they're like, no, we don't want to pay for that. We'll just pay for, this medication, and only if this medication is prescribed at this dosage and only in this frequency. I bet you didn't know that, right? So they dictate a lot. So if you go to your pharmacy and you're like, oh, your insurance doesn't cover this, ask your doctor if they can change it. Well, it's not like the doctor did pick a medication that they didn't think was best for you. No, they have to work within the insurance limits that for your insurance when you use your health insurance. Okay. And often, what happens with insurance is they prioritize cost over care. Okay. So if they look at it, the cost, they're going to deny it first. Like, what else can you do? But then they look at the immediate cost and not the long-term cost, mostly for people. So that's what I usually try to emphasize for patients, to let them know. Okay. So when you remove the insurance component, I remove the interference. Okay. So in my virtual cash-based practice, the visits are more in depth, and the care is personalized and not rushed. we base our decisions on what you need and not what's reimbursed. Because even if your insurance is dictated, the healthcare system that physician may work for, they look at that like, okay, that's not a reimbursable service, so we're not going to offer that, even though it may help you as a patient. And we focus on prevention and not just billing codes. So, those billing codes. So we used to have actual um, meetings that we would have to go to during lunchtime or during clinic hours that then, also reduces our time to see patients, or interferes with our family time, not being able to, attend a school event, to actually learn all these different codes, because the more in depth the code is, the more reimbursement that the insurance company will give to the hospital. Hmm. Like, so you may think like, what are all those codes that you're putting in? I don't have this illness. Um, so a lot of my patients would say, oh, they never told me that I had kidney issues, which if you have a diagnosis of diabetes or a diagnosis of high blood pressure, you really want to pay attention to those kidney numbers, because that is something that you may not be aware of, you don't even notice, you have no symptoms of, but your kidney numbers could be coming down because those diagnoses, those illnesses in the body actually affects the kidneys and affects them a lot. So you just may look at that. But anyway, I digress, because there's so much that you can go on with those billing codes. So it is something that we do not have to focus on in my practice, because we are looking at you as a whole person, looking more for prevention, and actually getting to the root of chronic illness. And again, when you have no insurance initiative that's really driving the visit, then we don't have to worry about that as much. We can just focus on what you tell us and what we would actually work on as a team to get the best care that you need. Okay. Then my second thing that I love actually in my practice is the virtual care, which means there's no driving for you. There's no sitting in the waiting room. You're not sitting there while someone's coughing and not covering their mouth, sneezing and not covering their mouth, which is very irritating to me. But I digress again. But anyway, when you have virtual things, you do not have to take time away from your life too much. So you don't have to take off a whole half day of work to try to get there. You don't have to be, exposed to traffic, anything like that. So this model of care actually allows me to practice medicine the way that I wish I was trained to do, and the way that you'd actually deserve, like to really focus on the care for you. So the care is for you with my practice if you are ready to be proactive and not reactive in your healthcare. If you want partnership and not quick fixes. So if you're ready to partner with me, I'm more than willing to partner with you. If you're tired of just monitoring your disease, so let's just see how this goes and see how this medication can kind of help keep it at bay, and not just a whole person approach, and actually try to help to heal from the inside. And then also, if this practice is for you, if you believe that your health is worth protecting, okay? It's not about perfection, it's about progress. And I know you've heard that before. And sometimes now it sounds like cliche, but I don't expect you to change everything all at once. And you shouldn't expect yourself to change it all at once either, okay? So that's not what we're looking for. We're looking to make some progress and change to where you feel better. And a lot of my patients feel better within 5 days of just changing a few things in their habits. 5 days, like it's actually miraculous of just how you feel initially. And that is your positive reinforcement to keep going. To say, I'm not going to give up on my health. I'm going to keep going. And it's about choosing a path that leads to freedom and not more medications. Okay. So if this message that I just talked about resonates with you, I invite you to take the next step with visiting me at www.dramandamd.com/services. And you can see the services that I offer. Certain states have more services than others. But yes, you can learn how we can work together. Okay. So don't forget to go there. I'll make sure I link that in the chat so you can actually come there and book your service. Okay. So before we end, I want you to think about this. So what if that your blood sugars were stabilized without fear? Your blood pressure improves naturally without more medications. You understand your body instead of feeling betrayed by it. You're not saying, why is this happening to me? You woke up with energy and confidence, and you just didn't live longer. You lived better. Well, that future is possible. And it starts with, again, just one decision. And that decision is booking your appointment with me again at www.drmandamd.com/services. And we can start working together immediately. So your health is not a burden, it's a gift, and it's worth protecting. So thank you all for being here, and hope you all have a blessed rest of your day. Blessed and health to y'all, and I look forward to seeing you next time.